Hey everyone, welcome back to The Explainer. Today, we're laying down a rock-solid foundation for understanding the strict guardrails of healthcare compliance. If you're stepping into the medical billing and coding world, you need to know right off the bat that this isn't just about punching in numbers. It's about protecting sensitive data and operating within a highly regulated environment. So, let's get started.
All right, here's our roadmap for today. We'll kick things off by defining healthcare compliance, then meet the actual rule makers. After that, we're looking at individual payers and their strict deadlines, diving into core HIPAA privacy mandates, going over everyday office confidentiality, and finally, looking at the real cost of non-compliance. Let's jump in.
Section 1. Defining healthcare compliance. We're going to start with a macro, top-down look at what this actually means for your day-to-day operations.
You know, compliance isn't just some corporate buzzword or a gentle suggestion. When professionals talk about compliance in the healthcare sector, they mean a medical practice has implemented a very real, concrete plan. It's all about operating strictly by the book to stop fraud and abuse committed by healthcare providers dead in its tracks. So, the big takeaway here is that you're essentially building frontline defenses. At its core, healthcare compliance means a company or an individual has set up a system to conduct business under the strict federal guidelines established by the U.S. Office of Inspector General. You aren't just processing claims, right? You're actually upholding the integrity of the entire medical billing system. Moving on to Section 2. Meet the rule makers. Let's go ahead and demystify this alphabet soup of federal heavyweights who actually set the rules of the game. First up, we've got CMS, which stands for the Centers for Medicare and Medicaid Services. This agency is a massive player. They manage Medicare and Medicaid, catering to millions of Americans, including the most vulnerable populations. But here's why they really matter to everyone. CMS sets the national standards that even commercial private payers end up following. They basically set the baseline for what's medically necessary and how operations should be built. Next on the list is the OIG, or the Office of Inspector General. Established way back in 1976, this is actually the largest inspector general office in the entire federal government. Their main job? Keeping a super watchful eye on how taxpayer money is spent. They perform audits and hunt down waste, fraud, and abuse in government programs. And trust me, when the OIG investigates and finds an issue, it usually triggers policy changes across the whole healthcare landscape. And finally, we have the AMA, the American Medical Association. While CMS and the OIG are busy handling the regulatory and financial oversight, the AMA is the group that creates, updates, and holds the copyright for CPT procedure codes. They literally dictate exactly what each medical code denotes. Section 3. Individual payers and strict deadlines. Now let's shift gears a bit and see how all this applies to the rules set by private insurance companies, also known as individual payers. Check out this stark contrast in operational urgency here. Every individual payer has its own unique processing guidelines, so while CMS sets a standard for Medicare that gives you a fairly generous 12-month window for claim submissions, commercial individual payers, they do not have to play by those rules. They often give you way less time, frequently enforcing a super strict 90-day deadline for timely reporting. So as a biller, if you're missing paperwork, that clock is ticking incredibly fast. Fail to meet those unique deadlines, and the claim simply won't get paid. Section 4. Core HIPAA privacy mandates. Beyond just billing deadlines, we absolutely have to understand the 1996 Federal Standard for Privacy, HIPAA, the Health Insurance Portability and Accountability Act. As a medical biller or coder, you pretty much need to have these core HIPAA mandates memorized because they govern exactly who gets to see a patient's most sensitive data. First off, HIPAA safeguards personal health information, or PHI. It guarantees patients the fundamental right to access their own data, and it forces providers to actively disclose their privacy policies. It also strictly limits unauthorized disclosures. And here's a really empowering feature for patients. HIPAA allows them to track exactly who accessed their data over the last 6 years. That level of transparency means every single time you open a file, there's a record of it. All right, Section 5, Maintaining Office Confidentiality. Let's bring this right down to the micro level, your daily reality and individual responsibility inside a medical office. This quote right here represents the absolute bedrock of patient confidentiality. It's beautifully straightforward. Information should not be disclosed to those who do not need it. Since you're a professional handling this data, you are bound by a strict confidentiality agreement. When patients hand over their most identifying personal details, we owe it to them to handle it with the utmost care. In practice, this means protecting the simple things. Take the waiting room, for example. Patients do not need to know each other's names, addresses, social security numbers, birth dates, or why they're visiting. You have to make sure they never overhear private details. But it also dictates your own daily practical habits. You need to keep your speaking volume low when discussing patient finances on the phone, manage complex passwords to lock down your digital files, and actively stop unauthorized visitors from wandering into secure areas of the office.
Section 6. The cost of non-compliance. Failing to uphold these guardrails carries some very severe personal and professional consequences.
Listen, taking your signed confidentiality agreement lightly is a massive mistake. It could literally result in absolute financial ruin or serious jail time. The law mandates investigations into all alleged HIPAA violations, and the penalties under HIPAA, they range drastically. We're talking $100 fines for a simple unintentional mistake, skyrocketing all the way up to $1 million or more for uncorrected negligence. For willful disclosure or financial fraud, you could be looking at a potential 10-year prison term. You are handling people's lives in those files, and the law absolutely treats it that way.
So, it all comes down to this. Are you ready to be the frontline defender of patient privacy? As you continue your training, keep that question in the back of your mind, because at the end of the day, you are the ultimate protector of these vital healthcare guardrails. Every code you input and every file you secure maintains the integrity of the whole medical system, and more importantly, the trust of the patients.
Please like, share, and subscribe to Decode Healthcare with Herschel.